Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Mohammed AlSheef, your host for Elixir of Life, live from Saudi TV, Channel 2, kicking off another inspiring and informative episode with our distinguished guest, aiming to explore new frontiers and bring you the latest and most up-to-date information related to health. Our program or show is filled with many inventive and stimulating segments. Most importantly, our episode theme, children's diabetes. It's my pleasure to host Dr. Mohammed AlHarbi and Alaa, Rashad, to discuss very important topic, diabetes in children. Without further ado, we'll go for a break. Once again, welcome back to Elixir of Life. We'll go for the first segment of the program is Quote of the Week. Please stay with us. Once again, welcome back to Elixir of Life. Our next segment will be medical news, and we'll talk about the 4th International Network for Blood and Marrow Transplantation. Please, to see more details on this report, stay with us.
Here's with me His Excellency Dr. Qasim Al-Qasabi. Doctor, what could you tell me about this conference?
Well, today King Faisal Specialist Hospital and Research Center is hosting a symposium and workshop in cooperation with the World Network for Blood and Marrow Transplantation. This is their 4th meeting, and also in cooperation with the WHO in the Kingdom of Saudi Arabia. And the meeting is 3 days. It's for 2 days workshop and 1 day symposium. And the aim is really to emphasize and elaborate on the centers which are going to be established, whether new centers or improving the current centers which they handle or the stem cell transplantation, particularly for blood diseases and for other related disease. And we are very proud today, and the number of registers of the people who registered in the symposium is very high, above 1,000. So I wish that the symposium will be helpful in elaborating and discussing the updates on stem cell transplantation and bone marrow transplantation. And we are in King Faisal Specialist Hospital and Research Center. We are proud that we are one of the leading centers worldwide in bone marrow transplantation.
Thank you, Doctor.
I'm Dr. Faisal Frey, hematology and bone marrow transplant consultant from King Faisal Hospital in Riyadh.
Doctor, what can you tell me about this special international conference?
So today we are, King Faisal Hospital in Riyadh is hosting the 4th Worldwide Bone Marrow Transplantation Congress. It will be over 3 days with participation of from 32 countries and 15 associations and societies.
How important this event?
So it's in collaboration with WHO. The scope is to help establishing new transplant centers in the region, as well as to help expanding and improving existing programs.
Doctor, is there any message you want to deliver for the viewers?
So at the same time, we do have a campaign to register as stem cell donor with an aim to save a patient with a blood cancer. I would like to welcome your viewer to visit our booth in the exhibition or in the North Tower and to sign up to save patients with blood cancer.
Once again, welcome back to Elixir of Life. Our next segment will be Health, Myth and Fact. To watch more details in this report, please stay with us. Once again, welcome back to Elixir of Life. Now we are coming to the most important segment, our topic of the week, children's diabetes. Children's diabetes, it's, discovering that your child has diabetes type 1 can give rise to many shocking emotions. When children are diagnosed with diabetes, patients need to be very engaged in learning about their condition. They have to be involved in the decision-making plan. Without further ado, it's my great pleasure and honor to present our distinguished guest, starting by Dr. Mohammed AlHarbi, consultant endocrinologist and diabetologist, and our distinguished guest, Ms. Alaa Rashad, clinical nutrition from National Guard Hospital. We will start by a question to Dr. Mohammed. What's diabetes mellitus?
Thank you very much, first of all, to host me in this to talk about this important subject, which I think it's concern a big slide of community. Actually, we are talking about diabetes. Let us go back to the normal. What's the normal things? When a person eat food, it will yield at the end with glucose, or what we call sugar. This is very important for our energy to move, to understand, to talk. We need energy. So this energy coming from this sugar.
Glucose.
Or glucose. We can name it glucose or sugar. There should be balance between the sugar we are taking and the sugar we are serving or reserving. Usually the sugar which we take, or the glucose we take from the food, it will go in three ways. Either I will spend it in the expenditure, I mean I use it as energy, or I reserve it in the body. If you want to,
yes, go ahead,
to explain that, the sugar we can reserve it or store it in the liver. It's one of the stores, or muscles, or fat cells.
Sure.
So and then the third thing is we can omit it outside. So the third part of the sugar will go outside.
Through urine, okay.
Through urine. Okay. So this is there should be balance between these three things. If there is no balance, then the disease will appear. Either diabetes, if the sugar is high, the store is full here in liver, and the store is full in muscle, the store full in in fat cells. So where will the other the rest of this sugar will remain in the bloodstream. So it causes hyperglycemia or more sugar in the blood. This is what we call diabetes. And diabetes actually it's a Latin word called mean siphon, or go through extensively, mean urination. More excessive urination.
Sweet urine, okay, that
mellitus. This mellitus would mean honey, in Latin. So it's honey urine and actually when they discovered diabetes 2,500 years before Jesus Christ, they observe that the ants will go to the urine of those people who is usually having weight loss and the flesh go out. So they're having a lot of urination. So the ants will collect there. Then they think this is different. Maybe this is the reason.
So this is ancient disease. This is since
it's 2,500 before Jesus Christ, and then coming. So the organ which is responsible to control diabetes and make this balance between the sugar in the bloodstream and the sugar stored is pancreas. If you remove the liver, we'll find that the organ, the small organ here, just below the stomach and pancreas, liver, which is called pancreas. And pancreas have different cells. One of them is called beta cell. This beta cell which secretes insulin, which regulate sugar in the blood. So if the patient have deficient insulin, then the sugar will come up in the bloodstream, and hyperglycemia appear, and then the disease appear.
Excellent.
So this is in general diabetes.
Excellent and simplified explanation for dear viewers. So this is leading us to the next question, Dr. Mohammed. Is there any types of diabetes? We heard about often type 1, type 2 diabetes. Which one is relevant to children? Okay.
Yes. Actually, there is 4 types of diabetes. If you want to summarize things, the type 1 diabetes, when there's the beta cells in the pancreas, which is secrete insulin, is destroyed.
Langerhans cells, okay.
In the beta cells, no, not Langerhans. Beta cells.
Beta cells.
Yeah, when the beta cells destroyed by the immune system of the body itself, and this is genetic, has nothing to do with environment, and has nothing to do with inheritance. So usually the child will born with it. He has these antibodies, but it will, with the time, it will destroy the beta cells until the disease appears. This is what we call type 1 diabetes. And usually type 1 diabetes affect children or young, less than 20 years of age. It's very rare to have type 1 diabetes between 20 and 30s, and we call it late onset of diabetes, type 1. The other type of diabetes, type 2 diabetes, when the beta cells is not destroyed, it's there, but it's not secreting a lot of insulin or enough insulin to control the sugar in the blood. Why? Because of the obesity, usually coming after obesity. So there are a lot of insulin secreted at the beginning, and then there is resistance to the work of insulin, and this is what we call it type 2 diabetes. The third type, which is called gestational diabetes, which usually appear with the pregnant ladies and disappear immediately after pregnancy. The fourth type, which is genetic types, this about 13 or 14 types of diabetes, which is genetic, and it's behaving like type 1 diabetes and treated like type 2 diabetes. So it's different, but it's genetic, very, very rare. It counts very less than 5% of diabetes in children.
Okay, so we say that diabetes is starvation in the midst of plenty, okay? There is plenty of sugar, but the tissues are starved, okay? Because insulin, glucose not entering the cells.
Not entering because there is no insulin doing that.
Excellent. Again, just to go a step, further, that how the parents recognize their kids they have diabetes. Okay.
Actually, for type 1 diabetes, the first sign appears weight loss. When the child starts to lose weight, even he's eating well, even he's not moving a lot, but he's losing. Why? Because we are reaching about 50% or 40% of insulin deficient in the body. So the insulin, it's known that it's building up our cells. So if there is no insulin, this build-up, it decreases with the time.
Anabolic hormone.
Anabolic hormone. It's anabolic hormone. So because of the deficiency in insulin, there will be no build-up of the body. So the weight loss is appearing usually 3 months before the symptoms start. Then when the threshold of sugar exceed the threshold of the level of sugar or glucose in the blood exceed the threshold of kidney, which is 180 milligram or 200 milligram, then the kidney start to get rid of this glucose. So when it get rid of the glucose, it will drag the water with it. So the child will go to the toilet a lot. He's going. So this is first sign.
Frequent voiding. Okay.
Second sign is urination, a lot of voiding. Because of losing the energy, because as we are losing 4 grams of glucose in the urine, we are losing 1 kilocalorie. So as losing calories in the urine, the child start to have the feeling of hunger. So he want to eat. Though he is eating, still he want to eat because he's losing energy. So polyuria, or what we call urination, a lot of urination, and because he's losing fluid in the urine, he should drink a lot of water. So a lot of thirst coming with that. Okay. So this is the signs. First of all, weight loss, then a lot of excessive urination, combining with excessive intake of water, and intake also of food because of the energy. Lately, if this continue and the parents did not discover that and they did not take the child to the hospital, then it will come when there is absolute deficiency of insulin, and then the child will go to the state of acidosis, what we call diabetic ketoacidosis. Yes. He will go to a state of acidosis when he has abdominal pain, drowsiness, and maybe he will have coma at the end, and he will the respiration it will be very fast, and because he is trying to compensate the acidosis he has, so then he will go to a case of the state of diabetes ketoacidosis, which usually brought him to the hospital. About 45% of the patients coming to the hospital due to diabetic ketoacidosis.
Okay, so about, let's say, 50% discovered early before diabetic ketoacidosis, and the other 50, present late.
Actually, it depends on areas, and depends on also in countries, because some countries only 25 or 15% those who go with DKA. Usually they are discovered
early because more awareness.
Yeah, here in Saudi Arabia it's about from 45 to 75% of patients coming with DKA.
Okay, so this is our data. That's interesting.
But what recently this improved with the time, because parents, there is a lot of awareness, so they can discover the disease as early as before they have DKA.
I think that's important. Awareness is the best prevention. That's why from our program, we would like to disseminate more awareness about health diseases, health and disease. Now, just to go to Saudi Arabia, do we have data? Because we are lacking data for many diseases. I hope we have data, regarding children's diabetes in Saudi Arabia.
Yes, actually, for type 1 diabetes in children below 15 years of age, according to the International Diabetes Federation, we are the 7th country in the world. Seventh country in the world. We have about 16,200 children with diabetes type 1 below 15 years. And we are the 5th in the world in the annual incidence of type 1 diabetes in those children. About 31 diabetic child per 100,000 per 100,000, not per 100, per 100,000 children in this age. I mean below 15 years. So we are actually in the first line of type 1 diabetes. Type 2 diabetes still is not so clear in children, and we don't have a lot of data about that because it's still new disease. If we are counting now, we have a lot of obesity in children. I think we will have a lot of children with type 2 diabetes also. In the United States, it was for decades, the type 2 diabetes was not the disease of children. Even here in Saudi Arabia, it was not the disease of children. Usually after 20 years of age, they will develop type 2 diabetes. But we are seeing now.
Seeing right now?
Yes, and we have 8 years with type 2 diabetes.
What's the percentage,
type
type 1 and type 2 in
actually, in general,
in Saudi Arabia?
In general, all over the world, and Saudi Arabia, one of them, among them, 90% type 2 and 10% type 1 diabetes.
That's for overall, okay.
But type 2 diabetes in children in Saudi Arabia, yet we don't have a lot of data.
Okay, but not as common as...
no, it's not as common as type 1 diabetes, but it's coming. In United States, some of the states, the type 2 diabetes in children is more than type 1 diabetes. So it's coming more and more.
Very intriguing.
Yeah.
Doctor, so is diabetes a cause for type 1 diabetes mellitus in children? Obesity? Or this is a coincidence, okay?
No, obesity is not a cause of type 1 diabetes. It's the cause of type 2 diabetes.
Like type 2, yeah.
But if we are managing patients in the future with no balance, and maybe we'll talk about this, about diet and insulin, if the patient is eating a lot and he's taking insulin a lot, then he will end up with obesity.
Sure.
He will he will increase his weight.
Because just to correct some, misconceptions in the community, they think that the child eating a lot of sugary food will have diabetes mellitus type 1. What do you think about this? Okay.
Well, it's not right. It's not the correct statement. It's not about the type of the food. It's about the quantity of the food. So when you sugar is not dangerous. If you take more sugar, it's dangerous. But if you take a balanced one, it's normal. So balanced diet is the most important thing. Whether patient was diabetic, whether patient was hypertensive, no matter what was the disease, you need to have a balanced quantity of food.
Excellent. So that's very important. Doctor, now after child is having as you mentioned frequent avoiding of urine, thirsty, losing weight, how we confirm diagnosis? How we diagnose? Okay, can we diagnose at home or should we diagnose at hospital?
Actually, yes, some of the families, they have this glucometers with them at home. So usually they are going there and picking the child and checking if he has diabetes or not. And I don't agree on this method, because it will give you wrong answers all the time. It will give you wrong answers. These glucometers we are using with who is already diagnosed with diabetes, and just to follow his blood sugar. But to diagnose for the first time, it's better to go to the hospital.
Okay.
So the blood will be drawn and plasma will be separated, and then we'll see the sugar in the plasma. And this is most accurate to diagnose the child. The other thing is hemoglobin A1C, or what we call glycated hemoglobin, or the store of hemoglobin in sugar in the blood. There is a certain limit. If it's exceeding it, I can diagnose diabetes also. So I have to have a good method of diagnosing it. Lab investigation should be done to confirm the diagnosis of diabetes. Sometimes the child, if he's playing with sweets and you prick the finger to see his blood sugar, it will be high because of the sweets here in his finger. So I don't recommend to use this glucometer as a diagnosis.
As first, okay.
As a diagnosis. You can, the patient can use it later on just to follow up his blood sugar.
So is there any diagnostic criteria like fasting blood sugar or 2 hours after meal or hemoglobin A1C, because you have pointed out this? Okay, do you have any figures that just actually,
for diabetes, if the fasting blood sugar exceeding 100 is 100 or more, we are starting in the area of diabetes. Up to 125 we call it pre-diabetes, and it's usually with type 2 diabetes. In type 1 diabetes there is pre-diabetes, it's not obvious. If that sugar, if the blood sugar is more than 125 fasting, this is diabetes, this is diagnosis. For hemoglobin A1C, it's 5.6 is the limit. If exceeding 5.6 up to 6.4, this is what we call it pre-diabetes. More than 6.4, that means he has diabetes.
Excellent.
So if we in children, we prefer to have 2, not depending only in 1. If anyone has random blood sugar, more, 200 or more, then we diagnose him as diabetes.
In addition to symptoms.
In addition to symptoms. But in children, we have to be very careful in diagnosing diabetes. We have to have at least 2 to diagnose the child with
fasting
diabetes.
or and
fasting
after
and
excellent.
And hemoglobin A1C.
It's the same, you know, reference figures for adult, as you pointed.
It's the same.
Excellent. Well, thank you, Dr. Mohammed. We'll go right now for a report about living with diabetes. To see more details in this report, stay with us.
I don't really remember what our family was like before diabetes. It's just always there.
I was diagnosed when I was 2.
I picked her up one afternoon. Her commented that Molly sure was cranky and cried a lot today. And she said she was thirsty. Did I think she had diabetes? I didn't even know what diabetes was. It didn't occur to me. I called Molly's godmother, who actually happens to be a type 1 diabetic herself. And she said, and I quote, "Run, don't walk to the doctor. Molly has diabetes." It was devastating. We immediately went to Children's Healthcare of Atlanta and received 2 days of training in reading food labels, meal planning, how to count carbohydrates when you're out at a restaurant. How do you go about, you know, counting carbohydrates and so forth. So the diabetes educators at Children's Healthcare of Atlanta were just really amazing resources for us because we knew nothing.
Clap, clap, tap, tap, tap. When I wake up, I check my blood. Before I go to school, I usually check my blood. Before we have snack, I check my blood. At the end of the day, I check my blood again. And I do a shot every night. It's just kind of a part of my life now.
I mourn the loss of spontaneity, the ability to run out to the ice cream truck, because you got to check your blood sugar. Molly, if it's too high, you can't run out to the ice cream truck, or you can go get an ice cream, but you have to save it for later until we bring your blood sugar back into a normal range.
If my brother just goes to get something to eat, and like a cookie or something, I'm just like, "Can I have one?" And no, you can't.
Oftentimes you hear diabetes and you think, oh, this person must need to lose weight, a little exercise, perhaps some oral medication, or my daughter, for instance, she'll outgrow it. So there's a lot of misconception about this disease out there. We have to give Molly additional insulin.
For her, though, it's life and death.
Heart failure, loss of vision. Ultimately, you could have circulatory issues and lose a limb.
Managing her diabetes before school.
It was time for her first shot by myself. I'll never forget it. She was 2 and she's running away from me and, you know, of course, scared for her life. And I picked her up and I put my leg up on the kitchen counter and I threw her over my leg so that I could shove a syringe. And that's just counter to anything that mother's instinct tells you, that you have to put your child through that. And it was going to be multiple times each day, every day, until when? Until there's a cure. So that was the punch in the gut.
Welcome back to Elixir of Life, and just to remind, our episode theme is children's diabetes, and my pleasure again to welcome our guest, Dr. Mohammed AlHarbi, consultant pediatric endocrinologist and diabetologist, and Ms. Alaa, Rashad, clinical nutrition and dietitian. Well, now we have discussed how the kids, present, and diagnosed, and the causes. And the numbers in Saudi Arabia. Now we are going to the most important. Everybody is waiting. How diabetes mellitus type 1 managed in children?
Actually, type 1 diabetes, the only treatment of type 1 diabetes is insulin. there's the different only the modality of delivering this insulin, whether it's a needle or it's a pen or it's an insulin pump. It's different modalities of treatment, but at the end it's insulin. And insulin, there is a regimen of insulin. You have it's 2 times a day or 3 times a day or 4 times a day, or insulin pump, which is continuously delivering insulin to the child. So what I want to tell the parents and the people, that there is no treatment of type 1 diabetes except insulin. Even if the child is growing to the adult life, still the treatment is insulin, only insulin. It will not change with the time to type 2 diabetes. Type 2 diabetes, the treatment is depending on lifestyle and oral medications, and maybe insulin at the end, if
later stages.
Late. But for type 1 diabetes, the only treatment from the beginning is insulin. And actually, I want to change the little bit the mode of the report. We have a lot of patients with type 1 diabetes, and they are growing very well, and they have a very nice life. They have children. They are
living with diabetes, coping.
They have a wonderful life. So it's not depressing sort of. And to be honest with you, type 1 diabetes, if you control it well, you will live up to 90 and 100 years without any problems. But type 2 diabetes, even if you are struggling with him, you will have complication. So it's good that type 1 diabetes, just
it's rewarding.
Know what to do.
It's rewarding the management.
What to do? Just know what to do. Control your diabetes. You will be you will live very wonderful and very nice life. No problem at all. And actually, management of diabetes, I will tell you that it depends on 3 pillars. And any ceiling on 3 pillars, if you remove one of them, it will fall. It definitely will fall. So the 3 pillars, I will talk about one of them, and I'll leave the other 2 for Ms. Alaa to talk about it. The first pillar of management of type 1 diabetes is insulin. How to give insulin, when and how much.
Excellent.
And related to your food or to your movement.
Excellent.
The other 2 pillars is lifestyle, I mean exercise in general, and food or diet.
Okay. Excellent. So insulin alone is not the treatment or management. It has to be combined with healthy lifestyle changes. Now we are.
It's not the answer. It's not the answer at all. Insulin is not the answer. Yes, you can take insulin as such, and you'll protect your life from death. Yes, because insulin is life and death, as they said. It's life and death for type 1 diabetes.
It's like elixir of life for diabetic patients, because our program, the name is Elixir of Life.
Yes.
So insulin is the elixir of life for.
To control diabetes, we have to have these 3 pillars.
So important, message. Even just to comment on the report. So we treat diabetes type 1 with insulin, not to cure the disease, to prevent complication, to control the symptoms. Am I right, or?
Actually, what we are talking about missing part of the body, which is a hormone, missing hormone in the body, which is insulin. Just give the insulin.
That's all. Okay. Or we can talk later on about transplant and etc.
Later on.
Anyway, we will go to a most important question. Dr. Mohammed beautifully illustrated that there are 3 pillars. Okay, and he talked about the first pillar, insulin, and the second pillar is healthy, balanced diet. So what's the recommended balanced diet for diabetic kids?
Well, first of all, as Dr. Mohammed said, it's 3 pillars. The mother or the child need to know when she needs to get her insulin, and she needs to have a fixed time to take the food. So when she needs to be awakened up, she needs to have her breakfast with a good amount, and she needs to check before, and she needs to have the insulin. I'm talking only about type 1 and type 2 diabetes that's treated with insulin. Then you need to have snack in between breakfast and lunch. That's why when a child has been diagnosed with diabetes, we need to go to tell the schools that this kid have a diabetic. So when her snack or his snack is on time, she needs to go and eat it. Then you need to have a lunch, then snack, then dinner, then a snack. You need to have a fixed time. So when you're gonna to avoid both sides, to avoid hypo and hyperglycemia. These the cases I usually deal with regarding diabetic patients. Patients don't think, like Dr. Mohammed said, they just think that when they're gonna take the insulin and that's it. So they're gonna live their life and everything will be fine. No, if you miss someone, the boat will sink.
Boat will sink. Okay.
Yeah.
So is there any specific, diet you want, for diabetic patient?
Well, at first you need to know how many kilocalories you need to give the patient.
Okay.
For example, according to the age requirement, fluid, and protein requirement in the body that the body needs. Some of, basically maybe 80% from the patients that I deal with are severe malnutrition. Maybe they're eating really well, but they have a lot of malnutrition problems. So when I give kilocalories, I tend to work with the doctor on the other side that I'm giving extra calories and extra protein to support the weight growth. Because at the end, the child growth is what matters. So most of them, I gave them amount of kilocalories and I distributed on 3 main meals and 3 snacks. For example, it's not needed to be healthy as much contains nutrition.
Nutritious too.
Yeah.
Okay.
The food need to be nutritious for the kid. So when we're talking about breakfast, we need to have we do replacement. Lifestyle changes is really hard on a child when the family are not following a healthy lifestyle. This currently in our community is a lot. That is, the mother is not having breakfast, she sent her child to the school without breakfast, then he is going to be fasting until the lunchtime is going to come, then that's it. So different lifestyle need to be starting from the own family, because we're talking about children. It's like your children is copies from you. So you need to start doing breakfast, contains brown breads.
Brown bread.
Sources of protein, boiled eggs, tunas, chicken, like breast chickens. All of this as a breakfast. You need to have a sufficient amount of fluid as well. And this is for the breakfast. Your snack need to be as light, like yogurt, flavored yogurt maybe, but the yogurt that you can done it at home. To the lunch, you need.
What's the time of the snack after the breakfast?
Well, if we're gonna talk about like what we call school time, he's gonna be awaking at 7 o'clock. So the mother, she needs to be awaking before, so she will be providing breakfast. Then 2 hours, he needs to check the blood sugar. Then if it's low, he needs to take a snack. Then the lunchtime at 12 o'clock maybe. That's why there is a lunchtime, and most of the schools lately, they provided meals to the kids who have diagnosed with diabetes. Then at 12, then at 3, when the kid at home, he needs to have a small snack, even if it's 1 cup of juice. But we just need to give him a little bit sugar once at a time. Then the dinner. Then if he, like now, what is the latest thing in children, that they stay up until 12 midnight or 1 o'clock. So we have a long time, so we need to give snack as well.
Before sleep.
Before sleeping time.
Excellent. How the parents know the calorie count in the food? Is there any way just to food label we hear them?
Well, you have 2 different managements in diabetic. There is 2 different type diet modification. There is the diet that you need to choose the healthy stuff. You need to take care about. Not everything taste sugar contains sugar. Maybe it does not taste sugar, but it really contains high level of sugar. So you need to educate the parents to read exactly the food labeling for the kid.
Like rice, to interrupt you, rice is not
rice,
sweet.
It's not sweet, but when you chew, it is not sweet. But when it
also
go inside your body, it turns to be the highest sugar. So this is first. Second, you need to what we call it. You need to train your child to love healthy food. You need to train him. Like now, when I ask mother, does he know fruits? She only told me, no, we don't eat fruits at home. We don't eat vegetables. So awareness of the community, especially fathers and mothers, this is the first step to the child.
I think the parents should be role model for their kids.
Exactly.
They eat healthy food, will encourage them.
Yeah, we'll encourage them. I have a lot of patients who like 100% following the diet, and their children, as Dr. Mohammed said, living happily ever after. They learning to be friends with their disease.
Okay.
not only
Very nice.
fighting
Okay.
it.
No, no. That's very interesting. You mentioned that the calorie count, it's available in the food label, okay?
Yeah. So like when I have a newly diagnosed diabetic, I sit with him. This is the most important session, and I gave him the chemical names for the sugars, like aspartame. There are a lot of like products contain no sugar or sugar-free, but you find substitute of sugars inside of the label, so he can eat whatever he wants from it. Then he's gonna come back complaining of hyperglycemia in his blood.
Okay, interesting.
Yeah, so you need to exactly read the labels. You need to be educated enough for your child life.
What about you know, healthy lifestyle, about exercise for kids? Okay.
I usually require for my patients to at least 30 minutes, even if they want to walk outside of their house. And even for the children, I told them, if you have this break time 30 minutes, go and walk inside of your school area. Don't just sit down. Even I guess there is the PlayStation lately have these kind of games that he will move. He will require to do physical activity like
Excellent.
moving.
Excellent.
So I tend to choose the best suitable exercise for them. They can't go for the gym for sure if they have the school time, but at least when you're staying at home, go up and down on the stairs, for example, like 10 times up and 10 times down for 30 minutes, as much as you can do.
I think exercise easier, you know, for kids than adult, okay, because usually kids are active or they're playing. I think we covered the 3 pillars, the insulin, diet and exercise beautifully by our distinguished guest. Just before we close, I want just to hear take-home message from Dr. Mohammed and from Ms. Alaa. Can you just give us the take-home message for, you know, dear viewers about this episode? Okay.
Actually, the message which I want to send the people that they said usually, maybe a lot of doctors will disagree with me, that the disease is your friend and the treatment is your, the disease is your friend. For me, no, disease is your enemy and your friend is the treatment.
I like it. Very nice, okay.
Actually, this is what I usually tend to tell the people. I know there's a lot of propaganda in that you have to be friend with the disease. No, disease is my enemy. I have to fight it. I have to fight the disease. My friend is insulin. Whether it's pen, it's insulin pump, it's injection. This is my friend. This is which will protect my life. This which will, if I deal with it very well, I will defend myself from diabetes.
Thank you.
It will not be with me.
Thank you. And Ms. Alaa, what's the take-home message?
My take-home message is like to the families, because if awareness is an important thing, go read, educate yourself. You will never know once your kid have diabetes. Once you educate yourself, once you aware yourself about your surroundings and make yourself ready for surprises, you would know exactly how to do.
Thank you, Ms. Alaa Rashad, clinical dietitian, and Dr. Mohammed AlHarbi, pediatric diabetologist and endocrinologist. I'm really delighted, for being with us. It was a great pleasure and honor. Now we'll go for the last segment of our show, health benefit. To see or to watch more details on the report, stay with us.
Once again, welcome back to Elixir of Life. We are coming to the end of our program. Before I conclude, just to mention that I hope and I wish you enjoyed viewing our episode and found it useful and informative and enlightening. There was wealth of information about diabetes in children from both our guests. Before we see you next week, I would like to thank our distinguished team, cameraman Yazid Al-Husseini, Salim Al-Uraybi, lighting, Fahad Al-Yahyan, sound is Al-Qasim, and prepared by Rashad Khalatid and presented by me, Dr. Mohammed AlHarbi. See you next week. Assalamu alaikum wa rahmatullahi wa barakatuh.